Whether you're running a marathon or just getting up to grab a snack, your legs are always on the move. But have you ever stopped to think about the incredible plumbing that makes all that possible? Well, today we are going to map it all out.
And our whole journey starts right here, on the main highway, the femoral artery. You can think of it as the major interstate that kicks this whole thing off. Pretty much all the oxygen-rich blood your leg muscles need to function flows through this one powerful vessel. Now, don't worry, this isn't going to get too complicated. Our route follows a really clear, logical path. We're going to start on that main highway, the femoral artery, and just follow it as it branches out into smaller and smaller roads, delivering that precious cargo exactly where it needs to go.
So let's start at the beginning, on that main trunk line for the entire leg, the femoral artery.
So where does this highway actually begin? Well, it all starts with blood getting pumped from the heart down the massive aorta. That aorta then splits into the iliac arteries. And right as the external iliac artery crosses into the thigh, boom, it gets a new name, the femoral artery. And just like that, our journey down the leg has officially begun.
Okay, so as soon as our highway enters the thigh, it immediately starts sending off these crucial off-ramps to supply this big muscular area. So here you can see it, right? The main road, the femoral artery, just cruising straight down the thigh. But look closer. See all those branches it sends off along the way? Those aren't random at all. Each one has a very specific job to do.
The biggest of these branches, the absolute heavyweight, is the profunda femoris. It dives deep to fuel the real powerhouses, like your quads and hamstrings. Then you've got others, called the circumflex arteries, that kind of wrap around the hip joint to keep it supplied. And of course, there are smaller branches that take care of the skin and more superficial stuff.
So, our highway is now approaching a really complex intersection. As it passes the knee, the artery actually changes its name and its whole strategy to supply this vital, super flexible joint.
You see, once the femoral artery ducks behind the knee into a space called the popliteal fossa, it gets a new name, the popliteal artery. It's the exact same road, just with a new name for a new region and a whole new set of responsibilities.
And the first job of this newly named popliteal artery? It's to make sure the knee joint itself is totally secure. To do that, it sends out this network of 5 branches. They're called the genicular arteries, and they create this amazing web of supply lines that wrap all around the kneecap and the joint.
This network is just an incredible piece of biological engineering. All those little genicular branches, they all connect with each other, forming what's called an anastomosis. You can think of it like a natural detour system. So if one little path gets pinched when you bend your knee, no big deal. The blood can just take an alternate route to make sure the joint never, ever loses its supply. How cool is that?
Okay, so leaving the knee behind us, our main artery is about to hit its most significant fork in the road. It's right here that the highway splits to cover the entire front and back of the lower leg.
So the popliteal artery splits in two. The anterior tibial artery, that one heads to the front to supply all the muscles of your shin. Meanwhile, the posterior tibial artery travels down the back, feeding your powerful calf muscles. It's a simple, really elegant division of labor.
And you can see that split right here. There's the popliteal artery at the top, splitting into the anterior and posterior tibial arteries. But, hang on a second, what's that third one?
That third vessel. That's the peroneal artery, sometimes called the fibular artery. It actually branches off the posterior tibial artery, and it takes responsibility for all the muscles on the lateral or the outside part of your lower leg. So with those 3 arteries, the entire lower leg is now fully supplied. Every part is covered.
We've done it. We've arrived at our final destination, the foot. This is where the arteries fan out to deliver their precious cargo of oxygen and nutrients all the way to your toes.
So, the anterior tibial artery continues over the top of the foot where it becomes the dorsalis pedis artery. That's actually the pulse you can feel on the top of your foot. At the same time, the posterior tibial artery splits to supply the entire sole of your foot through the plantar arteries.
So, why does this whole highway system even exist? What's the point? Well, it all comes down to one thing: delivering oxygen. Every single muscle, bone, and skin cell in your leg needs it to survive. At the very end of the line, in these tiny little vessels called capillaries, that oxygen gets dropped off. The blood becomes deoxygenated, and it begins its long journey back to the heart through the veins.
And this brings us to one last thought. We've just mapped out this perfectly flowing system. But what happens when there's a traffic jam, say from a plaque buildup in this critical highway? All of a sudden, this anatomy isn't just academic anymore, is it?
It becomes the absolute key to understanding and maybe even preventing some really serious circulatory problems.